Greetings. Welcome to the Brain Gauge channel. I'm Mark Hammerdall. I'm going to talk a little bit about some case studies. And you can learn a lot about your patient from case studies. You can learn a lot about reading other people's case studies. And the purpose of these is just to go through some really simple, relatively simple ones, just to give you a feel for use of the brain gauge and talk about treatment, tracking treatment efficacy. So let's get started. And the first one is first one's really straightforward and somewhat of a typical case study that we see from sports concussion. And this was simply I simply put this one up here because I I just want to ground you into and what the brain gauge scores look like. And basically, remember that when we collect data with the brain gauge, we collect a multiple tests and we look at a lot of different metrics. And those are translated, the responses or the results of the tests are translated into a number of metrics. And that's what you see right here is that you see, all these different metrics. And then the overall metric is a composite, and it's either called the cortical metric or the overall metric. It's a composite of the others. And in this case, this is day one post concussion. So let's say day zero is actually the day of concussion, but day one, subject doesn't look great. Day six, there's been some recovery. And in this case, day 14, they did pretty well. And in most of the subjects that we've studied and in our studies, which is quite a few in the hundreds, upper hundreds, is that kids or student athletes who experience a sports-related concussion, they're usually cleared between 14 and 21 days. So day 14 is nothing unusual for them to be cleared after 2 weeks. So anyway, just wanted to point out these scores are scaled both in length and color. Red is bad, green is good, long bar is good, short bars are bad. And they're all scaled to the normative value. So you're shooting for the value of 100 here, and anything down here is 0 or 5. That's very low. So let's get started. Let's go to the next study. And this is another sports concussion study. And this came from somebody getting a face mask pulled. And basically, on day two, he took his impact test. Impact is an online cognitive assessment or concussion assessment tool. And basically, impact is something that requires a baseline. The brain gauge does not require a baseline test or a preseason test. Impact, generally, they will have a preseason baseline test. And on day 5, this person's impact score was the same as his baseline. So they were actually cleared by impact on that day. And the scores are better, but there's still quite a bit of room for improvement. On day 11, the subject was cleared to play, and the scores look pretty good now. Now, the people clearing him don't depend on our scores, or didn't at the time, but we were just collecting the data to show what happens when they're cleared. Now, what was interesting about this was that actually after this person was cleared, they said, okay, now you go take the weekend off and you'll start practice on Monday. And they decided, let's take one last test before he resumes play. So they took one last test and they looked at the scores and said, why are your scores worse? And I actually got a phone call. And the person that called me said, their scores are worse. Why are their scores worse? And I said, well, it's Monday morning. What did he do over the weekend? I'm guessing he partied. And it turned out it was a big party weekend. And the response I got initially was, no, that couldn't be the case because he's on concussion protocol. Therefore, he couldn't have been drinking. I said, well, looking at these scores and looking at how much he's changed and just looking at which scores got worse, I'm going to say he was drinking. And 45 minutes later, I got a phone call back and was told, guess what? He was drinking all weekend. So I think he got sat out for a few more days because of his non-compliant behavior. Yeah, drinking when you're still recovering from a concussion, even though it's really not good. But drinking over the weekend, you will have an impact on your scores. Um, so brain gauge does help with compliance. People know they're being checked, and actually we're doing some work with parolees, and when they look, when they know they're being tested, uh, they basically have better behavior when they know they're going to be tested in a day or two. Okay, let's look at another one. In this one, a wrestler got whacked on the side of the head. And the interesting thing I'm introducing here is a SCAT score. And SCAT is a pretty good indicator. It's a sports concussion assessment tool. It's really just a symptom checklist. But here, SCAT is 11, then it's 3. And then day 16, they were symptom free on SCAT. And they also were cleared. So basically, these are data, the brain gauge reflects how they're doing. Higher numbers are worse. So 11 is worse than 3, and 0 is really what you're shooting for. The problem with that, it's not very quantitative, not very objective. And, if they choose to not tell the truth, then they don't. About 8 to 10% of student athletes kind of fudge on the SCAT. Even it's dependent on their self-report. And a lot of them will kind of fudge because there's a lot of pressure for them to return to play. 3 months after recovery, and this happens periodically, concussion symptoms come back. He was tested again. He clearly had some other issues going on, had some headaches in class, and anyway, had to sit back down from participating. Let's go on to the next one. Here again, this is another one where we actually saw 2 concussions on the same subject. And you see that is symptom scores of 16. Brain gauge scores weren't terrible, but they weren't great. They were very good when he became symptom free. And this was all early in the season. He was a football player, and it was beginning of the year. And then a month after that, which is really not that long in terms of physiological recovery, he basically got another concussion. And even though his scores aren't terrible and his symptom score is pretty high, this takes a long time to recover from. And, that his scores really didn't get a lot better until about 4 months. And that's when he became symptom free. So, these scores, it takes a long time to recover. If you have a concussion, a second concussion, it just takes a really long time. And that's something that you need to be aware of when you're tracking people. Now, this is a little different display. And in this one, I'm showing you the timeline of the individual. And also because I've got some numbers on this timeline that correspond to a group study that when we look at the overall group. And in this case, this is obviously this was another football injury, and he was pretty messed up. These are pretty bad scores, but so it took him actually quite a while to recover. In this case, it took 4 weeks to fully recover and get cleared. That's what this is when he completely cleared, and these are scores, and those are very good scores. If you're familiar with the brain gauge and you've been using it, you know that these are very good scores that this person recovered on. Well, anyway, injury was item number 1, or timeline point number 1 is time of injury, and timeline number 5, that's when he was cleared. What happened in between? Well, number 4, this is sort of from our group study. This is the point where most people are cleared by a physician. So that's kind of the golden standard for recovery. Item number 3, generally that's when people recover and pass impact. And that's sort of, most kids pass impact on day 7. And that's in the literature. There's been a lot of people, and you talk to any athletic trainer, say, yeah, they usually pass day 7. So they get an injury on Saturday, they're ready to go the next Saturday. They usually pass and clear to, and you can figure out what you want from that or extract whatever data you want. Item number two, cleared by BEST. That's a balance testing tool. And, I'll just go out on the record and say balance testing is a joke. I mean, come on, you guys, stop doing that. Stop wasting millions of dollars on people telling them they need the balance test. And I'm being very, very nice on this. This is the point where we saw on several hundred subjects, they were on average 15% better after the injury than they were before on their balance assessment. But this is pushed by a lot of people. And so, for whatever reason, you want to test brain function and quit doing this stuff with balance testing. It doesn't work. Okay, so let's go on a slightly different study. PCS, post-concussive symptoms or post-concussive syndrome. You choose what you want to call it. These are patients that were treated with pulsed electromagnetic field. And I just showing you whole clusters of these different patients because the data is so rich and it's so good to look at. But again, we have pre-treatment, and notice that there are different time scales for each patient. Pre-treatment, 2 months, 5 months, 6 weeks, 3 months, 3 weeks, 3 months. But in other words, all these people had a different time course of recovery, even though they were getting the same treatment. And that's the thing to remember. One of my colleagues in concussion research is fond of saying, if you've seen one concussion, you've seen one concussion. It's the same thing as saying, actually, if you've seen one patient, you've seen one patient. Every single patient's different. And you have to really analyze each patient and think about, what it is you need and what it is you need to give that person, what it is they're lacking. So pre-treatment, all these scores are really not that great. These are all mild TBI. These were all ranked as mild TBI. So interesting to know, this person, even though it was mild, they did pretty poorly on that test. But they all got better and they followed this trend. There are more patients in there. Some were actually classified as moderate and severe at the time of their injury. Now, keep in mind, these symptoms persisted. Some of these people had been injured 8 months, and their injury was 8 months prior to the study. Others as long as 8 years prior to the study. So there's really a long timeline that these symptoms persist. But all these people, they didn't start out all that great, but they had really nice recovery, or in most cases, and the overall group trend looks good. So keep in mind that you can learn a lot from a case study because every patient's different and we're not all lab rats. Okay. And that was an interesting study. Let's go back real quick and just say, look, all these patients were treated the same way by the same physician with pulse electromagnetic field. But if we take one more variable out of that and look at what happens with pulse electromagnetic field for head injury, these are 4 different clinicians using the same treatment on 4 different patients. So that just gives you a little more confidence in that particular method. And pre versus post treatment, you can see significant improvement. So now, pulse electromagnetic field has been used for a lot of other treatments, particularly for pain. And pain, and in particular chronic pain, has a significant impact on brain gauge scores. So these are the scores that this particular patient had before they had any treatment. Then they had 3 months of multiple sessions with pulse electromagnetic field. And obviously the post-treatment, their scores got better and better and better. Obviously they needed to continue that treatment. But they got a little bit better. So, and also note the overall score went from 27 to 71. That's a huge improvement. So anyway, let's look at another example of a pain patient. And again, this looks very similar. You see this long time course of recovery, in this case, about 6 weeks. And But the interesting thing about the pain is the reason that reduction, the pain reduction improves performance is because this area that is activated by pain, area 3A, has a negative impact on area 3B1. And this was a huge area of research, and we've been involved in this since I've been involved in this since the 1980s. But looking at these different areas and the interactions between these areas, but this has a huge impact on area 3B1. Area 3B1 handles a lot of things like, well, accuracy. So accuracy has got a big impact on that score, and that's because that's where the processing of mechanical inputs goes on. But if you really have this area highly activated by pain, it starts suppressing this area. And a lot of things do. Systemically, it's going to impact that area. Another thing that pain does, and as you can imagine, if you have chronic pain, it really impacts, or if it has an impact on stress and anxiety, has an impact on your focus score. But in just pulling this out, this is a different patient, but the focus score does improve with treatment of pain. And when we looked at this across a whole bunch of different subjects to see if their stress and anxiety is being reduced, and we found that pre-treatment versus post-treatment, we found a fairly significant improvement across group score. So this is a group score, and this is a final focus score, or the final individual score that was here. This individual scored very well in focus after they obviously reducing their pain, reduced their stress and anxiety. So anyway, hopefully you learned something from those case studies. If you've got a case study, please give me a holler. And you can email me at either mark@corticalmetrics or info@corticalmetrics. And thanks for watching. And that's all for today.